Dental care is so vital to general overall health. If you have active infection, active disease in your mouth, it doesn't stay limited to that part of your body. It can spread to other parts of your body. Everyone's heard of the connection between heart disease, lung disease, diabetes, all sorts of research that has been proven currently that there's a direct correlation between the bacteria that live in here and the bacteria that live in the rest of the body. So if you can keep the oral health of your oral condition in the best shape that you possibly can, odds are you're going to keep the rest of your body in much better condition. The patient just starting off in our practice, number one, has been warmly greeted on the phone. By the time they get through the front door, they're usually greeted by name, and they'll sit down with them and share our initial information gathering forms. Initial appointment involves step one, a review of dental history. Next, we review medical history in detail. We then usually start with a series of radiographs, very detailed, digital radiographs, which are quite mild, relatively speaking, from a radiation standpoint, but extremely diagnostic. And we share the information with them. Any questions they have regarding the x-rays are answered at that time. We then have the patient grab a mirror and we start to inspect their teeth, everything from jaw joints down to the smallest things inside the mouth. Following that, I re-review the radiographs and photos that were taken inside the mouth, and I sit down with all the charting that we've done and devise a tentative treatment plan with various options. Sit the patient down in the consult room with our treatment coordinator, run through in short summary what we looked at on the radiographs, what we found on the photos, what we discovered in the clinic, and then run through in detail against different sequences of the treatment planning. They can move along step by step, and it doesn't matter if they want to do it in 3 weeks, you can do it. If you want to do it in 3 years, you can do it. But at least each step that you're taking on the treatment planning, you're getting healthier and healthier and healthier. Once you get to the end of that plan, it's just regular maintenance. By sharing the education with them, or sharing some of the thoughts with them, their acceptance of it is so much more readily uptaken. And so it's far more successful for me, far more rewarding for me, I guess is a better term, for them to be able to accept it and see the progress that they can make.